process is what you're going to see in the mirror. This picture is a little bit dark, but you'll see a waxing of the teats, usually 1 to 4 days before foaling. You'll get distension of the abdomen, and of course throughout the pregnancy process you're going to notice that the mare is obviously going to be getting bigger, but usually a few days beforehand, maybe even a few weeks, you're going to really notice a drop in that ventral abdomen. Of course you're going to get enlargement of the udder, and then relaxation of the ligaments, excuse me there. If you press on the pretty much the rump area on either side of the tail, usually that area will become really, really soft the closer the mare gets to giving birth. Of course, you'll notice some behavior changes in mares as they get close to foaling. A lot of these changes can be similar to colic, so there'll be several times that I'll get a call to go out and treat a mare for a colic, and when in actuality she's just in the early stages of foaling. Horses naturally should be giving birth in the summertime, but due to man-made restrictions and the way things are governed and different aspects of the horse business, we like our foals to be born on January 1st. Of course, it's a cold time of year, so it's important that once the foal gets out, this foal is nice and wet, it's 20 degrees, or it's a night like tonight when it's snowing, I can guarantee you after I leave here, I may be going to attend a foaling session. So it's very important that we get these guys nice and dry. Of course, sterile gloves and sleeves. Nylon straps or chains if we're having trouble, mares having trouble giving birth. We may have to actually go in and put these straps around the foal's fetlocks to kind of help pull this thing out. Of course, an umbilical dip solution after the umbilicus breaks, we typically recommend a 0.5% or hexamine solution. That works best over iodine because there's a lot of debris stalls, and hexamine has a better killing power as opposed to here the placenta is already ruptured. This little clear membrane is the amnion. Of course, you have 2 front feet, and if you can see, you'll notice that those front feet are pointed down, which is obviously the ideal scenario. This mare also has her tail route, which usually is a nice thing to have as well, so the tail hairs aren't getting in the way. And of course, the third stage is basically, most of the time it's pretty boring. You basically want that placenta to come out of the mare within 3 hours. Some mares will basically expel the placenta within 30 minutes, sometimes even sooner. Some mares may actually not read the book and go beyond 3 hours, but even then, that could just be normal for that mare. But in our practice here in Lexington, any mare that goes beyond 3 hours, we typically always start them on antibiotics such as penicillin and ginseng. We put them on anti-inflammatories such as Banamine. That's the biggest thing we worry about, of course, is laminitis, retaining this placenta, or getting a metritis or infection of the uterus. So we're typically a little bit more proactive in this area. The level of care as far as horses go in Lexington is very different from what you may experience